We're here at the Business to Business Forum on Healthcare to discuss the really important issues to the business community about healthcare. There have been, for the last 30 years or more, really 4 issues that have been concerning us in healthcare and remain a concern for the business community. And those are access, cost, quality, and experience. And probably for the business community, the most pressing issue right now is the cost of healthcare, which just continues to accelerate. And it's a problem because we're not getting the quality and the experience that we should be for the amount of money we're spending.
Okay, so why is it important for the business community to be engaged in this dialogue?
So for businesses, the cost of healthcare, assuming they provide benefits, which most do, the cost of healthcare is the second largest cost they have of running their business after paying their employees. So, and it's frequently a cost that they don't directly control, and it's a cost that they find somewhat unpredictable. So we're here to help them understand the drivers of cost and, more importantly, some of the solutions that are being introduced around cost and improving quality and experience and value.
Okay, so what are some of those challenges and opportunities that you're presenting to businesses today?
So we want to have a dialogue with the business community around, for example, what's causing the rise in drug costs and how those can be moderated, how they can use wellness programs with their employees to help change lifestyles and other things, which are a big driver of people's healthcare conditions and ultimately costs. And then also talk about some innovation. I think Einstein defined insanity as doing the same thing over and over again, expecting different results. So we need innovation in healthcare to really fundamentally change the way care is delivered between a doctor and a patient. So technologies that allow us to deliver care remotely, the use of data and analytics to predict healthcare events and then intervene so that we're keeping people healthy and they're not decompensating and going into the hospital.
This is a great day. I mean, this is an opportunity for small businesses to become more informed about the healthcare market, what it is and what it will be.
And so why is that important in a greater context?
We just did a survey. 9 out of 10 of our members, this is their number one issue. It's about the premiums, it's about the uncertainty of the future, it's things they can't control. So it's an opportunity for people to become more informed and to ask their questions.
So what do you want people to remember today?
Well, my dream for them is they're going to be able to make informed decisions, both for their business and for their employees.
I want to welcome everybody here to today's Business to Business Forum on Healthcare Solutions. I'm Steve Udverhey, the President and CEO of Blue Cross and Blue Shield of Louisiana. And since 2 data points make a trend, this is the 2nd annual Business to Business Forum, and we're once again pleased to partner with others in bringing you this event, specifically GNO Inc. and the New Orleans Chamber. As many of you know, this is, as was true last year, an important time in the ongoing dialogue and debate about healthcare in our country. And while my crystal ball is not perfect, as we go into the midterm election year next year, I don't see the debate on health care going away. So that's a preview of maybe there'll be a 3rd annual event next year, depending on the feedback we get from today. In addition to thanking our co-sponsors, I do want to thank in advance our keynote speaker today, who will be joining us at lunch, Dr. Richard Milani of the Oxnard Health System, who will share with us his thoughts on innovation and improving health outcomes, which I think you will find enjoyable. I also want to recognize our panel members at lunchtime, Dr. Corey Hebert from Tulane, Dr. Vindell Washington of Blue Cross, and our moderator, Mike BERTAUT. That should be an interesting conversation as well. And then finally, we have a number of breakout sessions today, and I want to thank the individuals who will be leading those both later this morning and this afternoon. So what I'd like to do in a few minutes now, before asking my 2 co-sponsors to say a few words as well, is really just set the stage for the dialogue today in the context of healthcare and its importance for the business community. I think first and foremost, we realize that rising healthcare costs and the need to improve quality and healthcare experience continue to be a challenge for all of us. It's a challenge for employers, it's a challenge for providers, and it's a challenge for individuals, whether they be purchasers or patients. And it's true in New Orleans, it's true in the rest of Louisiana, and unfortunately it's true across the country. I've been in this business for almost 30 years, and the same four problems that were front and center 30 years ago are front and center today. And they are simply access, cost, quality, and experience. So the reality is, despite having what the world would say is some of the best doctors, best hospitals, medical device companies, pharmaceutical firms, and health IT companies in the world, and we're trying to attract, I know many of those businesses here to New Orleans, the system overall is broken because we're not solving those four issues in an effective way. The Affordable Care Act, we'll start with access. The Affordable Care Act was supposed to expand access, and to some degree it did that, although that's sort of in jeopardy and in limbo now with the debate going on in Washington. Reality is that today we still have 30 million people in America who don't have insurance. And I would say we don't talk a lot about this, and this will bridge to my next comment on cost, but for everybody else who has insurance, I think we still have a problem of underinsurance, because the cost of health care, even for people with insurance, is a barrier to them seeking and getting care. There's a lot of instability in the individual market, and the future of funding for Medicaid will be front and center of the federal funding debate. So let's talk now about cost. The Kaiser Family Foundation, which tracks this, said in 2016 the average cost for employer-sponsored contributions, this is the employer-sponsored contributions, was about a little over $18,000 a year. Now, to put this also in context of individuals, when the Affordable Care Act came out, 2014, and you were fortunate enough economically to be above 400% of the federal poverty level for a family of four, which was just about $100,000 a year in combined family income, then you would have had to have paid 30% of your gross income to buy a health insurance policy. Today, premiums in the individual market, for a variety of reasons, have risen by almost double in some cases. So it's becoming, even for people who have access to insurance, it's becoming unaffordable. And in the employer-sponsored market, at $18,000 is about a 60% rise for employers over 10 years. In that same period, employees have gone an increase of about 80 to 100%. So for employees, the cost of health care, even when they're getting employer-sponsored coverage, has also doubled over the last decade. And there's a lot of reasons for that. There are a lot of good reasons in that we can treat people in new and better ways than we were able to do a decade or so ago, but at a cost that's rising at an alarming rate. And I would just single out pharmaceutical costs because of some news that some of you may have seen last year. I mean, today for pharmaceuticals, we spend more in our healthcare system for pharmaceuticals than we do for physicians. And to highlight that cost of rising drug costs, I won't mention the firm by name, but a well-known pharmaceutical company released a new leukemia drug last year at the bargain price of $475,000 per single treatment. So that's the cost of the new drugs coming out, where we say in a personalized medicine, genomic tailored way, that's the price tag coming out of the new drugs there. So those costs are impacting all of you in the room. Those costs drive up the cost of health care. Cost of health care goes up, cost of insurance goes up. And why is that an issue for businesses? Because health insurance is typically your second largest cost of doing business after you pay your employees. And we're competing in a global economy. with countries that candidly spend far less than the United States per capita. We spend more per capita than any other developed country in the world, almost 18% of our gross domestic product. Most other countries are down around about 10%, so we're not quite about 2 times. And for that, we have the good fortune of ranking 34th in the world at life expectancy at birth. So I don't know about you, but I would say I don't know that we're getting what we're paying for in that equation. And the variation in cost is not just an international phenomenon. Costs vary across the United States. You guys may not know this, but we have a unique distinction in Louisiana, not favorable. In 2013, the Institute of Medicine published a study based on Medicare costs, but it's probably not that different for commercial. They rank ordered areas in the United States according to cost per capita, and of the 400 and plus large areas that they ranked, 6 of the 10 most expensive areas in the United States were in Louisiana: Metairie, Baton Rouge, Lafayette, Monroe, Alexandria, and Shreveport. So it's not south, it's not north, it's not the middle, it's all the above. And at that time, we ranked 49th in the country in terms of quality measures and outcomes. So we are a microcosm of the U.S. problem of spending a lot, but not necessarily getting the benefits we feel that we should. And I'll just end with this. So, you know, we're on the top of the bad lists and the bottom of the good lists. And I don't know that there's a list for healthcare experience, but for those of you who have been patients and or taken care of a family member who's been a patient, I would just ask you to do some introspection and ask, how easy was it to deal with the healthcare system broadly defined? And by that I don't mean the doctors and the hospitals, but the doctors and the hospitals and the pharmacists and the insurance companies, et cetera. I've been in the business for 30 years. It's not easy for me when I try to navigate the healthcare system. I kind of thought I figured it out before I moved here, but even after a year and a half here, it's hard for me to figure out how to move around the healthcare system in Louisiana. So the experience compared to other things we do in our life is complicated and not easy, and I think is ripe for innovation and other things to help transform that. The good news, in my opinion, is the American public will eventually put pressure on those of us in the healthcare system to fix this, because they're going to take their experiences everywhere else in life, and our kids are going to do it, right? Our kids that live on this device are going to say, I expect healthcare to meet me here. And if we in this room don't do it, by the way, I'm sure Jeff Bezos at Amazon has a plan. All right? I mean, I'm sure that people weren't, I'm sure that, you know, Albertsons and other people weren't expecting him to buy Whole Foods, and I think they're probably a little bit worried about what that means. So I think I'll leave with this. So the message is that these issues are complex enough, durable enough, that we really need to find a different way to work together to solve them. So hopefully here's what you're going to hear today. You're going to get ideas about how we're doing this. You're going to hear about insurers and providers collaborating in new ways, putting that patient member at the center. You're going to hear about how we're using data in new and innovative ways to predict healthcare events, not just look in the rearview mirror, and by using that prediction to give that information to doctors and patients to get them to change what's going to happen and avert those events. You're going to hear about using technology to get care to people remotely, new strategies for managing those rising drug costs, and lastly, ways that wellness programs can keep employees healthy. So it's not all doom and gloom. There is light at the end of the tunnel, even though it's been a 30-year journey with the same 4 problems. And also you're going to hear, I know particularly from Michael, about how healthcare is not only impacting businesses, it's a big part not just of the country's economy, but it's a big part of the regional economy. So we need to balance the way to take advantage of regional economy, helping that build our economy, with not adding to this cost problem that we already have. So with that, I'll end my remarks, and now I'd like to turn it over to Ben Johnson from the Chamber of Commerce for a few comments as well. Thanks, Ben.
Well, good morning. The New Orleans Chamber is a proud partner with Blue Cross Blue Shield and with GNO Inc. We think today is a very timely session. In the chamber world, we hear all the time from the employers and the employees how important health care is and how unpredictable it is. So what we were excited about in this partnership, it's allowing us to become more informed with a very timely topic that's impacting everybody in this room. The New Orleans Chamber just finished a survey among our members, and the question on health care was, what is the biggest concern you have about health care? 8 out of 9 members said their biggest concern was the cost of health care. 8 out of 9 members. I mean, this is just pivotal in everybody's mind. Other related healthcare concerned issues included the uncertainty of annual increases in health premiums, the uncertainty of the healthcare market and its requirements, and the lack of transparency in healthcare costs were the top issues. So today we have the opportunity to learn from experts, to ask our questions, and to network with our colleagues. It's vital, the information I think is going to be vital for all of us, both for our business's bottom line, but then also for each one of us as we pay our part of the premium for our families and our kids, our spouse. That this has a double impact, because some businesses, the smaller they are, the more they seem like they're concerned about going out of businesses. The larger they are, they know that's just a growing portion of their budget, disproportionately growing to all the other issues they have to face. So at the Chamber, we believe that informed people make informed decisions. And we think today's forum is going to enable all of us to become much more aware. And I can only encourage all of us to stay actively involved in this ever-changing, dynamic healthcare market and take leadership roles to voice our concerns and talk about the importance of having a healthy workforce, a healthy community.
What are the major take-homes that you want businesses to carry away with them today?
We want the business community to be engaged, to understand that it's important for them to work with not just us as an insurer, and they may or may not be using us, but that it's really, these challenges are so complex that what we really need to do is create an environment where the business community is partnering with the healthcare community and with policymakers and others to tackle these challenging problems. Because I think the working in silos is one of the reasons why we've been addressing these 4 issues of access, cost, quality, and experience for the last number of decades with really measurable improvement. And so that's the take-home message, is that we've got to work together in a collaborative way to make a difference, because I think the system is at a breaking point.
I think part of the problem is it's a very complicated, changing issue, healthcare. So for a small business to have the capacity to stay informed, to make the best decision, both for their business and for their employees, this is a great takeaway, either to learn today or to start making more connections to stay informed.
Well, I was fortunate enough to be asked to be the keynote speaker, so I gave the noon keynote, and then I was fortunate also to be on a panel with Corey Hebert and Vendel Washington, and it was a lot of Q&A between us and the audience.
What was your sort of a summary of your message from the speaking that you did?
Yeah, the message is really focused on the biggest driver of death and cost in the United States healthcare today, which is chronic disease, and how we need to re-engineer our healthcare system to be able to tackle it both effectively and cost efficiently. And we presented our own data demonstrating that we can do this. It's something that we can do. We can solve the biggest epidemic of our generation, which is chronic disease, in a very cost-efficient and safe way.
I now have the pleasure of introducing our keynote speaker for lunch, Dr. Richard Milani of the Ochsner Health System, who will share his thoughts, as I said this morning, on innovation and improving outcomes. I don't know about you, but I'm a little intimidated by these intro slides here. But before I introduce Dr. Milani, I wanted to follow up on one theme from my comments this morning. I mentioned that if we really want to change the healthcare system in a manner that addresses the four themes that are problematic: access, cost, quality, and experience, that it was going to take those of us in healthcare to work together in a fundamentally different way. And I specifically referenced that you would be hearing a little bit more about how insurers or providers are going to collaborate together to address these issues. So in that context, I'm pleased to tell you that you are the first to hear of an announcement that will be made public next week, but want to share it with you today, that Blue Cross and Blue Shield of Louisiana and the Ochsner Health System are launching a new partnership specifically aimed at improving quality healthcare experiences for individuals and businesses in Louisiana while controlling healthcare costs. And you may say, well, I've heard this before. What's different about this partnership? Well, what's different and unique about this partnership is that really for the first time in our long relationship, as insurer and provider, we are going to be fully aligned to implement a shared vision around what it takes to improve the healthcare system across the state. And we both understand that transforming healthcare is really the only way to achieve the results that we need. An initial component of this partnership is going to be a new and revitalized product that will come into the market in 2018 that you will be able to hear about this fall. It is called Blue Connect. And what it will do is provide members in the Blue Connect product with a coordinated focused care solution through a preferred access to the Ochsner Healthcare System and its partners. And what these members will have is not just access to the Ochsner network of primary care physicians, specialists, hospitals, labs, and other healthcare providers, but that care experience is going to, and you'll hear some of this in Dr. Milani's comments, it's going to include innovations in healthcare delivery. So these members will get access to same-day appointments, to telehealth services, to concierge-type access to care to help them navigate the healthcare system, and a focus on managing their illnesses in a way that keeps them healthy and at home where they really belong to be. The other unique part about this is that both organizations are going to share in the governance and have joint responsibility, not just for traditionally what we've both done, but we are going to collectively look at the financial performance, the market strategy, the product design, how clinical care is being delivered through the delivery system. And for those of you that may have heard Sumesh Nigam at his breakout session, we're going to begin to share data in an open and transparent way that, quite candidly, insurers and providers have not yet done in the marketplace, so that we'll be able to enrich the information on both sides of the equation. And what we think this will do is produce a product and an experience for people that is better and more affordable. And I think these are the kinds of partnerships that we need to engage in, again, as I said, to really transform the healthcare system. So I'm excited to announce that, and I think it's a good prelude to what you're going to hear from Dr. Milani.
Thank you and welcome. These are honestly not my pictures. They're coming live from Cupertino, but I'll get back to where we are. I can tell you, as part of Ochsner, we're very excited about this partnership. It really will align us in the same direction, the goal of which is to improve health outcomes. And it's something that I know Blue Cross, as well as Ochsner, and of course all delivery systems are interested in. And I think it really affords us opportunities to do things that without each other, well, we couldn't do any other way. So we're very excited. I'm going to start off with sort of our guiding principles, if you will. And this is not the guiding principles for just Ochsner. I mean, this is sort of a national, even international focus. And it's what's been called, for many of you, if you're not aware of it, called the quadruple aim. And this is true for all healthcare systems. And that is, we have to do a better job of improving the experience of care. And that includes quality, safety, and satisfaction. The health of the population. You know, I can do so many things to put a Band-Aid on things or even, you know, replace something, but at the end of the day, I'd like to leave a legacy where the population's healthier than where I started, and that's not always the case. Cost of health care has got unaffordable. We have to do our best to reduce the cost of care. And finally, there is a phenomenon that's getting made the cover of Time and a variety of other news publications about physician burnout and even caregiver burnout. We have to do a way to make the life of the caregiver easier and less complicated than it is today. So let me give you a pop quiz. I'm going to show you the 6 biggest economies based on GDP across the world, and here's what they are. And this is via the World Bank. So the US, followed by China, Japan, Germany, UK, and France. And this is their economic product, their GDP each year, and you see how they rank. Now, the quiz I gave to you is, if the United States healthcare system, if you carve that out and you made that a country, where would it rank? And let me show you where it would rank. It'd be 5th. We'd actually be bigger than the United Kingdom and France in terms of our size. And I can tell you, it's nothing wrong with big, but it's too big. It's 17.2% of our gross domestic product. It's about double all these other countries. We cannot afford the cost of healthcare today. We have to do a way of making us more efficient. That's why this kind of partnership that we're talking about today is exactly what's needed to be able to help fix healthcare. Now, of the 3.2 million, 2.75 of that, 86% of that, is one thing. That one thing is a grouping, but it's chronic disease. So that is the elephant in the room. We could talk about a million things today, but if we really want to do something to impact the health of the population, to reduce costs, improve quality, that's where the money's at. That's where it's at. So it's 86% of the dollars, it's 75% of the deaths. I mean, that is the elephant in the room. It's the #1 cause of disability, and unfortunately, statistically, half of us in this room have one. And if for any of us over 65 out there, then there's a 90% chance you're going to have a chronic disease. So it's an epidemic, and we ought to be addressing this epidemic. Moreover, it's not going anywhere. This is the projections for chronic disease going forward to 2025, and it's a problem that we're not facing today well, and it's not going away. It's getting bigger and bigger and stronger. Why? This is what the World Health Organization and the Centers for Disease Control tell us why we have such an epidemic, and it's primarily, not 100%, but it's primarily due to these 4 what are called health behaviors. So lack of physical activity, poor nutrition, tobacco use, and excess alcohol consumption, and the top 2 of which lead to an epidemic that we have today where 1/3 of Americans are obese or overweight. And that leads to a whole host of conditions by itself, of chronic conditions. So how do we manage chronic disease today? I don't care if you live in Singapore or in Japan or in New Orleans or Baton Rouge, anywhere else, and it's really 2 fundamental silos. There's the medications that can best treat it, so it doesn't matter, let's say you're a diabetic or you have heart failure or you have whatever it is, and there are guidelines that say, okay, the most up-to-date guidelines based on the current science says your best chance of survival, your best chance of staying out of the hospital, your best chance of doing well in life is going to be on these. And the only other thing we can do is trying to improve health behaviors, trying to improve lifestyle, and they have a very profound effect. And then finally, the 3rd arm is this: we survey. So I need to get you back to make sure that you're in bounds, you're not out of bounds. And there's nothing else. There's not a 4th or a 5th out there. So how well do we do? Let's look at the first one. How well as a nation do we get you on the right therapy for a chronic disease? And the answer is we score an F. It's less than a 50% chance today that if you go anywhere, Seattle, Boston, New York, California, less than a 50% chance that you'll be on the current best evidence-based care for that chronic condition. If you have heart failure, it's less than 30% chance, wherever you go. So are we doing a good job of making sure you're on the best medications possible to keep you out of the hospital, to keep you alive, to keep you well? And the answer is no. How about part 2? How well do we do in behavior? Well, this is data from the Google Food team and the Yale Center for Consumer Insights that tell us that wellness initiatives fail most often because they rely on placing too much emphasis on providing information. That's what we do in healthcare. We provide information. Evidence from behavioral economics has shown that information rarely succeeds in changing behavior or building new habits or food choices. Behavior often changes from intentions. So the point being is that we're not in med school, in pharmacy school, in PA school, in nursing school, we're not trained in behavior change. We say it's important to change behavior, but we're not trained in the science of behavior change. And if you want to know who is, there's two groups of people that are. If you're the honest truth, it's Madison Avenue, because they're getting you to buy their Cokes or eat their Doritos or whatever it is that they're selling you, and it's Las Vegas. And it works. Las Vegas gets you to gamble more. They do, then everything's a science there. This is not by luck. And that's true science of behavior change. And those are the true experts in getting to us to do things that we might not otherwise think about. Finally, the third thing. So we don't do a good job in behavior change. We do a horrible job in getting on the right medicines. And then finally, surveillance. If you have uncontrolled hypertension as an example, the average person in the United States today, 92% of which will have health insurance, will see their doctor 4 times a year. And they still leave with uncontrolled hypertension. So we don't do a good job even in the surveillance aspect. So if you look at the three sort of arms here, and it's not, when I say we, I'm saying not only just the US, I'm saying Europe, Asia, across the globe. These are the ways we treat, manage chronic disease. So why? How did we get this way? Are we intentionally trying to not do a good job? And the answer is, of course not. We've got great people in healthcare. But why do we fail? And here's why. Well, first, this is a survey of physicians in the US that tell us, you know, this is tough. Why are we doing so bad? Because it's tough, it's complex. I don't have enough information. I don't know what's going on when they're not here, in between visits. It's a tough thing, it's very complex. If you lived in 1990, the average man lived to a life of 46 years and a woman of 48. That was the life expectancy for a man and woman in the United States today in 1990. And how did they die? They died primarily of acute conditions. About 60% of the top 10 causes of death were all acute in nature. And we built our healthcare systems and delivery systems on the backbone of this. So if we were all on a spaceship and we were all going to go to another alien culture, and we're the experts in healthcare, and they said, listen, design a healthcare system around, for us, the first question that all of us would ask would be this: what do you aliens, how do you die? What are you sick from? And then we'd work backwards. So if we are having acute conditions, we'd build hospitals, we'd have emergency rooms, we'd have clinics, we'd have a waiting room. You come in, I break your arm, I fix it, you come back, and it's all good. But how are we dying today? This is 2010. The average male lives to an average life in 2010 of 76 and a female of 81. 97% of the top 10 causes of death are chronic conditions. But we're living in an acute care system model of delivery. So managing patients today, we need continuous data. How am I possibly going to manage a condition that's changing daily or weekly by collecting 3 or 4 data points in a year? Imagine running a business. Let's say we're selling pens or shoes, and we have sales all over the nation. You're going to check your books and your sales figures 4 times a year, and you're going to win? There's no way. You'd be out of business in no time. Somebody else would be eating your lunch. I'd be shifting supplies over here, moving things over here. I'd be checking multiple times a day. But we collect data on our humans and our patients with conditions that change daily or weekly 2 or 3 times a year, and then we expect it to work. The second thing we have to know about is this, and that is, in healthcare, we're used to what's the information collected within the healthcare system. And how much of that does that contribute to your health? So as a human being, your healthcare system, for the life of your life, will be responsible for about 10% of your odds of doing well or not doing well, influencing your health. What about the other 90%? Well, environmental exposure is responsible for 20% of the deaths across the globe. That's 5% of your lifetime risk. And believe it or not, you're saying, well, I don't live in a country that's got this problem. I hate to tell you, but you do. So even within our own country, we have issues related. I can show you how ER visits, hospitalizations are directly related in many cities in the United States to particulate matter. So environmental exposure is there. Social circumstances, it's bigger than the healthcare sector. It's 15%. So 15% of your life and your health outcomes will be determined by social circumstances. We'll talk about it. 30% is your genetics, and finally the biggest piece of the pie of all is behaviors. 40% is behaviors. So what about social circumstances? About 28% of people 65 and above live alone. And you go, so what? If you live alone and you're over 65, your odds of a heart attack or stroke go up by 30%, just living alone. And God forbid you're a woman over 75, because almost half of them live alone. And just that feature, just the fact that you're living alone, increases your heart attack and stroke risk, and that's other conditions too, which I'm not getting into, just that alone by 30%. All other factors controlled for.
I think it's important for business to be engaged because it's the health of their employees, that their employees are their workforce. We know that a healthier employee is sick less, is more engaged in the workplace, has less absenteeism, more presenteeism when at work, is more productive. So it's a win-win proposition for employers to want employees to be extremely healthy. And there are subtle ways that are not that costly that they can do that. So it's working together to figure out how we can improve the health of the population, not only of the general public, but also the workforce.
We're here today, it's very exciting, for the Business to Business Forum. What Blue Cross has learned is our Louisiana businesses make such huge investments in the health insurance of their employees. We wanted to make sure our employers had access to the latest and greatest information on exactly how to provide those benefits and what they can do to improve their employees' health.
Excellent. So why is this important in a grander context?
Well, remember, if you have health insurance and you live in Louisiana, 90% of you get your insurance through having a job or being related to someone that has a job. So employers make huge contributions to the healthcare system, and their wellness programs are critical to helping Louisiana get healthier. We have a lot of health challenges, as you might know, in our state: obesity rates, diabetes rates, and this is one step we can take to start putting some of that aside.
Well, you know, the landscape of medicine is changing daily, and between Obamacare and Trump care, people really just don't know the answers. And we know in a few weeks there's going to be a lot of information given out because Congress is going to vote on what we need to do with subsidies and many other things. So we need to equip the business community so that they can understand what the subtle differences may be, and maybe there may be some big differences, but they need to know all the information so that they can make sure that their employees actually have the best health care, but also that the business can actually get the best bang for their buck so that they can be sustained through the healthcare changes, because we want the businesses to be around as well.
Excellent. And so what are some of the important issues that businesses should be aware of?
I think a lot of times businesses, they don't look at the stress level of their employees, and that really equates with a lot of absence from work. They are not necessarily looking at the wellness of their employees. And so once you start looking at that and start trying to get maybe some wellness programs started, then that will actually make your business healthier because your employees will be healthier. Also, I think people don't really look at their the insurance that they're offering their employees. There are a lot of things that they can do to maybe streamline costs as well as increase some of the benefits, and you have to go through this stuff piece by piece to make sure that you're getting the best quality coverage and everyone is winning.
So Dr. Washington, I understand you have a recent article that's been released that's related to information technology in the industry. Can you tell us a bit about it?
Yeah, I was pleased to be able to have an article published today in the New England Journal of Medicine with the other 4 national coordinators of health IT who are working in the Obama administration. Our push was to talk about some of the progress that we had made in health IT, how it can support the better care in the country, but it was also to point to some areas of improvement, some opportunities that still exist. I think we made good progress in that period of time, particularly in the area of adoption of health IT. It lays the platform for a lot of things in the future for us, but there's still work to be done.
So how does that apply to what you're here for today?
Well, really, we believe that the foundation of improved health care is based on having good information flow. And before we had digital records, when everything was on paper, it was very difficult to do the kinds of analysis that's important for improvement, to really give transparency to businesses so they can understand how their healthcare dollars are being spent, to make businesses and members smart consumers. That was all a very important part of really setting us on the path for success here. So today when we're talking about really businesses and how they can take care of their employees and help them have happy and productive lives, the foundation of health information technology is a key part of that.
Excellent. So are there any other key parts that you think are important that businesses learn today?
Well, it's just the beginning in terms of some of our journey. And so what we want to talk about is really how this information flow can be used to support our overall goals. That's improving the health of all the citizens of Louisiana. So it really focuses not just on the actual delivery mechanics, but on some of the social determinants of health, how we take care of our environment, how we take care of the food, nutrition, and health aspects of life for the citizens of Louisiana. Blue Cross is really committed to that larger goal, and really having people have adequate coverage for care is one of the key steps. So we want to talk with businesses on how they can be smart consumers and how they can partner with Blue Cross and Blue Shield in making their members and employees just happier and healthier.
Dr. Hebert, you've been speaking a lot about how people don't know what they don't know when it comes to healthcare. In the case of businesses, they really need to find out what's going on so they can make better decisions for themselves and for their employees. It can be really challenging for them to figure out what they don't know. Can you talk to us a little bit about how access to more information can help employers make that leap to what they need to know?
Sure. First of all, thank you for having me, Dr. Maloney. It was a great presentation. And I'm sure a lot of you may have heard that these types of innovative things are happening, but they may not be happening at your hospital, and you're excited now about this. It's important that you realize what you don't know, because as you saw in the presentation, there are a lot of variables that you think aren't there that are causing people to not be healthy. Number one, let's think about this. A study came out by Dr. Chaudhry out of Harvard the other day that basically showed that people, even if you remind them, do not want to take their medicine. Even if you remind them, they don't want to do it. Now, why? Why? Because they don't like to be reminded that they have a disease. They don't. A lot of people think when they have asthma, when they go to the ER and they stop smoking for a second to get their breathing treatment, they go to the ER and they sit, and then once the breathing treatment has made them not die, they realize that their asthma has been cured. And then they go away because they think their asthma has been cured. But it has not been cured. A lot of people that have chronic diseases don't really like to think about it. And what we find is that when you use these innovative tactics to make sure that people kind of have these touch points to make sure that they are getting the information, there's one thing that myself and my group have done. We have a company called Community Health TV, is that when you give the information, if the information is a talking head doctor that's speaking to you in a way that your doctor speaks to you for 15 minutes when you talk to them, it increases the engagement, but it doesn't increase the engagement as much as if you have someone who looks like you, who sounds like you, who's speaking your language when they tell you to do those things. If that is the case, then that also increases the level of engagement by about 15 to 20%. So for example, if you have a young Italian man who is, I'm going to say young because I'm 48, so I'm going to say 47, who has hypertension, and you have a person speaking to him in a way, he's a carpenter, and you're having someone talk to him like he is a physicist about his hypertension, then that person is not going to really adhere to that because you're not speaking their language, whatever that language may be. We have social barriers, we have cultural barriers, we have lots of different barriers. And so we have a lot of new data coming out to show that people like to be spoken to where they are. Where they are. So having an O-bar, that's amazing because you can get to people where they are. I ask businesses all the time to realize that you need to be able to get to your employees, the person that is working the mailroom and the CEO. You have to be able to do that because the person that's working in the mailroom is making your business run. The person that is serving the food in the cafeteria is making your environment better. So if those people don't get the information the way that the same way, or receive the information the same way that the CEO is receiving information, then half of your business day is going to be inculcated with angry people with hypertension who feel like they've been left out. And what we found, especially I do these trainings all over the country at different hospitals, these people tend to be left out. And it makes a really bad business day. So what I'm asking folks to do and understand this very clearly. I was on a Today Show the other day, and we were talking about some new ways that people can decrease their hemoglobin A1C, blah, 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 blah. And it's really interesting because I just asked them, I said, the producers, I said, if I had a cure for cancer right now, could I tell them? And they said, no, you couldn't tell them. You'd have to say, we say, Dr. HEBERT has a cure for cancer, and we're going to talk about that cure for cancer next week at 6 o'clock. And they're going to tease it every day to make sure that people are going to watch. I'm in the media. And media is very important when it comes to this stuff because that's what you see. Everything is on your phone, folks. Everything is on your phone. And if you haven't invested, if your company hasn't invested in what Doctor discussed earlier, then you have to make that investment. Because that investment will make your business thrive. And what we want is a happy, healthy business with happy employees and sustainability for your business, because we don't know what's going to happen when Congress meets in a couple of weeks. We don't know. But we got to be ready. We got to be ready.
We know that health IT has expanded greatly in recent years. Why don't you tell us just a little bit, spend a little time telling us about how this has advanced the flow of information in our healthcare system and how that can lead for better results for our business clients around the state.
Thank you for that great introduction. I'll share with you something my wife said a couple of weeks ago when she found out that those articles would be published. She said, please, dear, enjoy your 15 minutes of fame. It'll be ending soon and you'll be back to normal. So, one of the things that I talked about in that article that I'd share with you, and one of the sort of driving principles when I was in DC was this idea of changing the way that healthcare was being delivered, and we sort of titled it Delivery System Reform, and much of what Dr. Milani talked about sort of fits into the sweet spot of that. So there were really three things that we were aiming for with delivery system reform. The first is really one of the main reasons I was so excited about the opportunity to join Blue Cross Blue Shield, which is you really have to change the way that doctors and hospitals are paid in order to allow for some of the great advances in care that you've seen described before. So this idea of changing payment strategies, when I was working with HHS and CMS, we talked about really ways that we could incentivize really keeping people well as opposed to the activities that we provide, that providers do daily to sort of intervene, but sort of concentrating on wellness and concentrating on value. And obviously, you'd heard earlier from Dr. Uberhai that really part of what we're trying to do with Blue Cross is to have similar partnerships and change the way those payment schemes work. The second was really the meat of what was discussed in the keynote, which is you really have to change the way that care is delivered. So the sort of traditional 15-minute or 10-minute sort of session with your provider every 4 months to review data, to collect a little bit of information at the front of that visit is really not the way that we're going to turn the corner in terms of value being delivered in terms of patient care and keeping patients well. So this idea of sort of touching those areas, even the aspects of the social determinants, really need new ways to think about it. And then the area I was most passionate about and have been for a fair portion of my life is that for 1 and 2 to happen, you have to have a different way that technology works as the underpinning of the health information system. So in 2009, if you really look at what was going on from an information flow in healthcare, almost all of medical care was provided and documented on paper. Less than 10% of hospitals had those electronic medical records that were discussed before, maybe a little bit less than 20% of physician offices. We made some policy interventions over that period of time and spent a little cash, somewhere around the tune of $35 billion, but who's counting? So we, to sort of support the efforts in healthcare IT. But today, if you look across the healthcare system, almost all hospitals and about 75% of clinical offices, physician office practices, have health IT. And that's the infrastructure on which some of these pivots can be made. And to the specific question, you really can't talk about really making these great interventions and stepping in and doing great things with patients unless you have digital information and that it freely flows from that one part of that system to the other. And I don't mean just among providers and payers. I also mean patients. We talk a lot about transparency. You saw some of the booths outside about some of the things that we're trying to do from the AIM shopper, some of the care delivery models. All those things are really powered by the free flow of information. And I'm just really excited about the partnership, but also about where we are in healthcare now that we have this foundation that's laid and all the new things that are on the horizon for us.
Excellent, excellent. Thanks, Doctor. What we're going to do now is go ahead and start looking at the questions you guys have submitted through Slido. Remember, slido.com/B2B is the location for the panel where you can type in your questions. We've already got some that our moderators put up on the board for us up there, our administrator. So why don't we go ahead and take a look at those. And the first one I see says, has Blue Cross Blue Shield considered incentivizing their clients for offering wellness programs with lower premiums? So, what do you think, Doc?
Yeah. So, and I'd spoken about sort of the partnership aspects earlier. I think that what we're trying to do, and a lot of the team that is more employer-facing is trying to do, is look for ways to partner as you go forward. And so, really, I think it's a new day and a new era in that space where we recognize that it's not just one lever that gets pulled. I used to tell this story about my life as an emergency medicine physician and my dealings with third-party payers and our dealings with folks in the community at that point in time. So my entire sort of deal with an insurance company at that time was to take a sheet of paper with a number on it that I wanted to be paid and to slide that back and forth between the provider until we both got tired or the day ended, one or the other. But what we're talking about now are all kinds of different ways to incentivize both members and the way the benefits plans are done and provided, and also to do that same kind of partnership with providers to really change the incentive structure for both of those parts of the equation and players. And so I think a lot of those things that may have not been traditionally things that we've talked about are clearly on the table as we begin discussions about how to best link those three parts of the stool to help us move forward.
Excellent, excellent. Let's take a look at the next question I've got. Is Ochsner or BCBS incorporating or planning to incorporate non-invasive wearable technology to monitor blood pressure, blood sugar, pulse ox, etc.? And if so, which ones?
Well, I can speak for Ochsner. I guess it depends on what you define as a wearable. So, for instance, in the video you saw that we had a wireless blood pressure cuff. That's not technically a wearable, it's just a connected device. And so the answer is, yeah, we're already doing that. And we hope to be able to work with Blue Cross to do it again for their patients as well. So the answer is yes. But we're also expanding now to go into diabetes and COPD. Again, these are not necessarily wearable devices, but if you're using a glucometer and you're checking your blood sugar, then why can't we get that information real time as well? And we can do that. If you're using an inhaler, every time you use your rescue inhaler, we can be notified about it. Not only that, but we can know the GPS coordinates of where you are, we can see what the environment is, and we can actually, help guide you in terms of preventing recurrences down the road. So these are not technically wearables, which this might be a wearable, or Fitbit would be a wearable, but they're connected devices that we routinely use, and they can really be utilized to advance the technology that we just talked about from a health IT perspective and use that as a platform to do a better job in terms of monitoring and keeping an eye on patients as well as intervening when appropriate.
If I can make just one quick sort of follow-up comment on really this idea of the first part of delivery system reform, changing how folks are paid and how incentives are aligned. What you really don't want to do in this situation is to constrain the innovation of providers in this space. And so in some of the better designed systems, and we're certainly hoping to sort of push forward with this from a partnership perspective, what we want to do is to make sure that new innovations, new care delivery models that help advance wellness in the community are not constrained by some of the former structures that were in place. So if, again, the relationship is I pay you only for activity, you do X, I pay you for X, you do Y, I pay you for Y, it hampers some of the sort of more innovative solutions that come forward. So we're hopeful that a lot of innovations, maybe even ones that neither of us have thought about to this point, can fit into strategy as we go forward, and we can incent both providers and folks in the community to kind of innovate and to bring great new solutions to market.
I'd like to add something as well. I mean, we are all in this room sitting here as the choir, and we're preaching to you, okay? So the issue becomes the people that are outside of these doors that are really burdening the healthcare system with not paying attention to their chronic illnesses and not treating them. So with wearables and things like that, those things are very important. But how do you get the person to wear the wearable? That's the problem. Because people that are here want to do that because you want to be healthy, but there are a lot of people that don't feel that way, and so it's a bigger problem because we know what makes people change. Fear and money most of the time, right? And when you try to, you can't scare people all the time, and you can't just give them a bunch of money. So you have to be able to say, what other things can I do as an institution or as a business or as a physician or nurse practitioner to make someone want to do those things? Knowledge is power. You need to get the information so that you can make really good choices for your employees and your business. We want the businesses to be around. We want the employees to be healthy. A lot of people think that those two things can't really coexist, that the employees are sucking a business dry because of their insurance payments and things like that. But in reality is that we have to make sure that everyone is healthy. The business is healthy as well as the employee, because that will make a cohesive unit to the business and the employee. The employees will have a team that will make the business better, which is better for everyone.
I think one of the main efforts that we want to put forward is that we're here to be partners with our business community, that we consider our clients not just the members, but the businesses and the community on a larger scale. For us to really achieve our mission statement of improving the health and lives of Louisianans, it takes more of a partnership approach. And so I would love for business folks to come us with problems that need to be solved, for us to sort of approach this from a collaborative perspective. And just as an addition, I think we're also looking at that kind of effort from the providers in the community as well. I think the partnership and collaboration is the one message I want people to take away from this session today.
I really want them to remember three things. Number one, remember that the latest and greatest data is available and that we're ready to share. Even predictive modeling is available, so we can start letting people know when they're more likely to be hospitalized. The second thing is, I want them to recognize that Blue Cross is a serious partner to business in Louisiana and that we value everything they do. And the third thing is, I want them to come out and relax and be in an environment of people who are teaching them how to do a better job and feeding them lunch.